Okay.
Hey Rick, how you doing today?
Good, Dr.
Right.
Shanti. Nice to see you.
Yeah. Okay, this first rib is out. We'll catch that when you're face down. Go ahead and go face down.
Yes, sir.
Okay, let's see what we got today.
Should I stand up on here? No,
Fine,
this is
Rick.
good enough.
Check these knees. There you go.
So you can help people with their knee problems?
Yeah.
I got knee problems right now.
Ah, good one.
Yeah.
That's my foot. You can help my foot?
Yeah.
Wow.
Okay, we got both sides here. You can actually feel that's nice and tight in there. Let's get this knee squared away. There we go. Got a lateral on this side too. So go ahead and just relax it, bring it on down.
Okay, sorry. When you get knee problems, it's hard to let somebody else have your knee.
It's okay. We come in right on your sits bone, right there.
Okay.
Mixing a little bit of techniques in here. Make sure the analysis is correct.
That was just a little tender.
Yeah. Right there. Okay. So let's see here. Now palpate your spine. Make sure those vertebrae, oh, that L5 is rotated, body to the right.
Palpate means to move it in circles?
Palpating is feeling the, I'm actually motioning vertebral bodies to feel them.
Like your heart palpates, right?
Well, your heart does palpate. We're palpating with our hands to make sure that, okay, so we've got T11 going on there. Looks a little higher than that, but it's not.
T11.
Okay, I'm going to have you take a deep breath in and all the way out. That is primarily going straight, goes straight.
Excuse me.
Okay. All right, take it. Let it all the way out.
Good one.
Nice key on.
Yeah. Sorry, folks, I'm a martial artist.
And now we're going to adjust that rib on the opposite side. And come back over here. All right, young man, I'm going to have to scoot you down the table a little bit so your shoulders are off that face piece. And let's get this. Okay, lift your head up, flex it up, take a deep breath in, all the way out. There we go. That really nice. Okay, let's come back up and get the rib head pull right in there.
I can feel it when you touch it.
Yeah. Okay, and we had the first rib on this side. I'm just going to lift your traps. Come straight on in. There we go, right there. Perfect. And let's palpate that. Okay, go ahead and go face up. Clear out your circles. Sorry, what's going on up here. Three. Okay, take a deep breath in and let it all the way down.
Ooh, I heard that.
But it didn't hurt at all.
Excellent. Clean that out. Up there you go. There we go. Okay, let's take a double check, see what's going on. Okay, look to your right, look to your left, down towards me, away from me, this ear to this shoulder, and this ear to this shoulder.
So what happens when you're doing all that? I don't see his foot moving, so that's good.
There's a little bit of motion.
Oh, you can't. I can't tell, but you can tell, right?
Yeah, yes, you can see.
Hey, the red light went on, Richard. Is that something?
Let me see.
What do I have?
Nope, we're still recording.
Okay.
Yep. Okay, so what I was doing is when he was face down, I was doing one type of back, so I did two different types of analysis when he was face down.
Right.
When he was face up, there's a different type of analysis as far as the leg checks that I do. And depending on which way I'm having him look, in whatever direction, it's going to let me know where up the cervical spine where I should double check. And I have an expectation, if I've cleared the spine out, what I'm going to see down here as far as analysis.
Okay. So you can see all the minute changes then, right?
You can
to me, it's like he's not even moving his foot. But I know you can see it.
Well, you can actually see it, but you can also, when you're holding the legs, and you can feel it. You can feel the difference of the tone from the bottom of their Achilles all the way to the top. The tone is very different. When there's dural torque going on in the spinal column, you can feel that tone. There's a tightness, a tenseness all the way through the whole body.
Oh, okay.
So that's why I do it. It's just for me to double check to make sure that I've cleared everything. You know, normally I'm very good. I've been doing this for a long time. So on palpation skills, I'm very good. But I always like to see what's going on as far as the science goes. Because chiropractic is a science, it's an art, and it is a philosophy. So, anyway, young man, you are all powerful today. Come on up.
Thank you very much, sir.
And now you are turned on.
So if you were a blind guy, could you be a chiropractor?
Absolutely.
Do you know they had that famous Japanese swordman, the blind swordsman?
Yeah.
The old, what do you call those, like in the 1960s? But the blind swordsman, his trade was, he was a masseuse. Because all but the hands, he feels with the hands. And then his side job was, he does, the samurai.
There's a lot of times when I'm adjusting patients that I actually will close my eyes, particularly when I'm adjusting.
Yeah, that's what you told me. You close your eyes like that.
Adjusting the cervicals, because I can see, I can visualize what's going on. I've had some patients ask me, "Why, Doc? Why in the world would you close your eyes?" And
you can visualize, right?
I can visualize.
Because I do that sometimes with my job like that. I quote, and then it's just like I can do it better.
Absolutely,
like that,
absolutely. So You know, I was adjusted by a 93-year-old chiropractor named George Parker. And I was very ill. I was actually in chiropractic school. This is going way back in the early 90s. And I had a sinus infection, and all the doctors in town, it was Christmas time, all the doctors I was up visiting in Vermont, couldn't find a doctor anywhere. Not a medical doctor, not a pharmacist, nobody. Not another chiropractor. The only one who was there was this guy. So I went in and I got adjusted by him. And I went in and I saw him and I got a little scared because his knuckles in his hands had so much arthritis. That guy sat me in a chair, palpated me, and moved my bones like butter. It was the
don't judge the book by its cover then, huh?
Absolutely, absolutely. I know of a chiropractor over on the Big Island. He only has one leg. I know a chiropractor on the mainland. I think he now is residing in Michigan. Only one hand. And but he adjusts. You know, if we can't do it by hand, I mean, if we don't have both hands, we also have, you know, chiropractic instruments. You saw me using the activator, which is, you know, it was one of the first federally regulated chiropractic instruments that there was. And I utilized it, that in the integrator, which is similar to the activator. This one you could cock it first because when I was younger, my son was younger. He dislocated some of my ribs and my arm, and I could not grasp the activator. So this one you could set the same stuff up, and then I can just put it in the right line of correction, and it will fire just like this. So that was, you know,
that's a good thing,
that was an absolute blessing until I got adjusted and got my ribs adjusted, and my arm and shoulder adjusted, and was able to get the strength back. But you know, being blind is not at all a deterrent to being a chiropractor.
Well, you know, like sometimes when I used to do jobs on the casinos, and we have to do a lot of screwing with the nuts like that. You can't see it. It's easier to just, you know,
close your eyes.
Instead of, because you can't see it, so you might be in a angle, and what you're looking at, you're probably screwing it crooked to begin with. So I close my eyes to visualize it, and then you feel a little bit that it goes in better.
Well, that's what you know. It's all in the fingers. It's all in the and it's just a learning how. You know, when I was at chiropractic school, they come out with these phone books. You know, the big old yellow page phone books, and they would take some string, some sewing string, or just thread actually, and they would put it in between, and they'd say, okay, we want you to find what page it's on by palpating. And then, like, you know, some people get good, they get in with a couple pages. Then at the end of the trimester, because we did all these, you know, 13, 14, whatever trimesters, it was a lot, they would put a couple pieces of thick, coarse hair in there, and they say, okay, now let's see who can find it. And it's like, you know, you're closing your eyes and you're concentrating, because it all is. It's like you're talking about putting those bolts on those nuts, you know. Those nuts on the bolts, it's like that. It's all that feeling. So.
Well, pretty cool.
Thank you very much, sir.
Okay, I'll see you guys later.